Hello everyone. So today we'll be studying the external features of spinal cord. This is one of the topic I taught in one of my tutorials and it's very important because spinal cord forms the basis of many things. So as we all know, the brain plus the spinal cord together forms the central nervous system. There are two types of nervous system, central and peripheral, and brain and spinal cord all together form the central nervous system. Now, the spinal cord, as we all know, is made up of two types of fibers, afferent and efferent, the ones that carry the signals from the brain to the peripheral system and vice versa. So, we come to know it is composed of bundle of efferent and afferent nerve fibers. And the basic function is that it connects the central nervous system to the peripheral nervous system. Now, the spinal cord, as we all know, is a cylindrical structure. It is cylindrical in shape. It is a direct extension of the brainstem. The brainstem that consists of the cerebrum, the medulla oblongata, the pons, and then directly extends via the spinal cord. If we discuss the extent of the spinal cord, it is from the foramen magnum of the skull to the coccyx or the coccygeal bone of the vertebral column. In males, it is around 75 centimeters long, and in females, it is around 42 centimeters long, weighing around 30 grams in both. Now see, this is the spinal cord along with the vertebral column. The spinal cord is enclosed within the vertebral column. And as we can see, there are two curvatures present here, which we'll discuss later in embryology. Like there are two curvatures, the primary curvature, the secondary curvatures. Then we come to the vertebra, the thoracic vertebra. And as we can see, the spinal cord ends well before the end of the vertebral column. That is, the spinal cord ends in lumbar vertebra, but as we all know, the vertebral column extends up to the coccyx. Now, within the vertebral column, the spinal cord is covered by three meninges. The three meninges, the same as we know present in the cranium. The three meninges from the outermost to innermost, the dura mater, the arachnoid mater, and the pia mater. Now, the meninges are continuous with the brain. Now, we discuss what is the function of the meninges. The function of the meninges is that it stabilizes the spinal cord. It surrounds the spinal cord along with the CSF. The CSF is present between the meninges and it protects the spinal cord from the external surroundings, and it stabilizes the spinal cord within the vertebral column. Now we come up to the meningeal coverings or the meninges surrounding the spinal cord. The outermost covering is the dura mater. The dura mater forms a dural sac. A sac is something which is closed at one end and open at one. So we can imagine it like the dura mater is open at the foramen magnum and closed or tapered at the end, and it forms the dural sac. Now we come up to the middle meningel or the arachnoid mater. It is named the arachnoid mater because arachnoid comes from the word spider-like. The literal meaning is spider-like. So because of its spider web-like appearance, it is known as arachnoid mater, and it is ballooned up against the dura. There is a subarachnoid space. The ballooning up of the arachnoid mater along with the dura against the dura, it forms the subarachnoid space, where it is filled with CSF. The CSF is present in the subarachnoid space and it protects the spinal cord. Now the spinal cord also needs nutrition. The spinal blood vessels around the spinal cord are suspended within small strands of tissue called as arachnoid trabeculae. The arachnoid trabeculae is in turn connected to the third meningeal covering or the innermost meningeal covering, which is known as we all know, is the pia mater. It is the innermost covering of the spinal cord. It adheres tightly to the spinal cord and it gives rise to a ligament or a extension of a pia mater, which is known as the denticulate ligament. Now we come up to the 3D model. We can see this is the dura mater along with the spinal cord inside the dura mater, and these are the extensions we saw. Now, what is the denticulate ligament? The denticulate ligament are basically outgrowth from the pia mater that function as anchor and provide stability to the spinal cord. These are paired ribbon-like extensions coming out from the pia mater. Extensions of the pia mater, and they come out of the pia mater and are attached to the dura or the dura mater. They arise medially between the anterior and posterior roots of spinal cord. Anterior and posterior roots of spinal cord. Next extension of the pia mater is filum terminale. Filumterminale. It is a pia mater outgrowth. It arises at the distal end of conus medullaris. It is a pia mater outgrowth and it arises at the distal end of conus medullaris. Arises at the distal end of conus medullaris. And what is the function of filum terminale? It stabilizes the spinal cord. How? As it goes and attaches itself to the coccyx. It stabilizes the spinal cord. Now we'll be looking at a 3D image or the 3D model. Now this is the spinal cord, the grey matter, the white matter, the central canal in the center. And now we can see that there are two nerve roots arising from this. This is, we are viewing it from the superior view. It goes inside the vertebral canal present in the vertebral column. You see, this is half of the vertebral column is removed here. Now in the lower side we can see the spine of the vertebra, and as we go down and down, this is the T3 vertebra, then we come up down T8. Now we are coming up to L3, T10, then L1, L2. Now the L1 is the structure, is the area where the spinal cord ends. If we dissect it further, see, the spinal cord ends somewhere between the lower border of L1 and upper border of L2. It is a very controversial statement as to where it ends, but according to most standard textbooks, it ends between them, between the upper border of L2 and lower border of L1. As we can see, the filum terminale is it is attached to the coccyx and it provides the stability to the spinal cord. Now we can see this is the spinal cord from the superior view, enclosed in the vertebral column. This is where it ends. This is the filum terminale and the cauda equina. The cauda equina I will explain now. The tapered end of the spinal cord is known as conus medullaris. The conus medullaris is the tapered end of the spinal cord. The bulbous tapered end is known as the conus medullaris. This is the place where the spinal cord ends and the filum terminale starts, and it is surrounded by long lumbosacral nerve roots. The lumbosacral nerve roots which grow all the way from the ending of spinal cord to the various respective vertebra where they come out from. The lumbosacral roots along with the conus medullaris forms the cauda equina. Now it is called a cauda equina because it has the horse tail like appearance. Equina is for horse, and so you can remember it well. Now coming up to the bones and the corresponding nerves. Now from the skull we have the cranial nerves, which is the cranial nerve 1st to the cranial nerve 12th. From the cervical vertebra, we have 7 cervical vertebra and we have 8 cervical nerves, cervical spinal nerves. How come? Because 2 nerves come out from the periphery of C1, one from the upper side of C1 and other one, the C2, from the lower side of C1. And for the next corresponding thoracic vertebra, we have 12 thoracic vertebra, 12 thoracic nerve, L1 to L5 vertebra, L1 to L5 spinal nerve. For the sacrum, because it is set of 5 bones that are fused, so it is S1 to S5. Then from coccyx, a singular coccygeal spinal nerve. Now we are coming to 2 enlarged areas of the spinal cord. There are 2 enlargements present of the spinal cord. Why there are enlargements? Because very important nerves, very thick nerves arise from these areas, which provide nervous supply to the upper limb and the lower limb. Now the cervical enlargement it arises from the C4 to T1 and it gives rise to the brachial plexus, which supplies the upper limb. The lumbosacral enlargement L2 to S3, it gives rise to the lumbosacral plexus, which in turn supplies the lower limb. Now we are coming to the external features of spinal cord. As we can see in this diagram here, the spinal cord is given. We are coming to the external features of spinal cord. As we can see in this diagram here, the spinal cord is given and it has an anterior median fissure. This one, the anterior median fissure is such because it lodges the anterior spinal artery. The deep anterior median fissure, it lodges the anterior spinal artery. Now coming to the posterior median sulcus. The posterior median sulcus is a thin longitudinal groove. It is not a fissure, it is a sulcus. It is a thin longitudinal groove from which a septum runs in the depth of the spinal cord. A septum runs in the depth of the spinal cord, but there is no fissure. It's a sulcus or a groove. Now each half has 3 parts: the anterior, the lateral and the posterior. The anterior part, lateral part and posterior part. Now there arises 2 types of nerve roots from this: the ventral or the motor nerve roots, or the dorsal or the sensory nerve roots. We'll study about these later in detail in the tracts of spinal cord, but for just now you have to remember that the ventral or motor nerve roots emerge from the anterolateral sulcus and the dorsal or the sensory nerve roots arise from the posterolateral sulcus. Now we are coming to the clinical part of this. Now there are 2 syndromes associated with whatever we have studied in this lecture: the conus medullaris syndrome, the conus medullaris syndrome. How does the conus medullaris syndrome occur? It occurs due to injury to S2, S3 or S4, that is the sacral 2nd, 3rd or 4th spinal nerve. Because these nerves supply the perineum, there is anesthesia in the perineum. Anesthesia in perineum. Also the involvement of bowel and bladder, that is the parasympathetic nerve supply to the bowel and bladder arises from this area, so the involvement of bowel and bladder is early. And then coming to the 4th point, the sexual functions are affected because the same nerve supply for the sexual functions, so the sexual functions are affected. This is the conus medullaris syndrome. Now coming to the second clinical, which is the cauda equina syndrome. The cauda equina syndrome. Now, what are the implications that are present in the injury to cauda equina? Now, there is lower motor neuron type of paralysis due to the compression of ventral nerve roots. Now, there are two type of paralysis we'll study later: the upper motor neuron type of paralysis and the lower motor neuron type of paralysis. The lower motor neuron type of paralysis is seen in cauda equina syndrome due to the compression of ventral nerve roots. Also, there is root pain due to dorsal nerve root involvement. There is pain in the roots, the root pain due to dorsal nerve root involvement. And the bladder and bowel is affected in the syndrome, but it is affected very late. So, the bladder or bowel is affected late. It is involved late. Now, coming to the applied anatomy, the applied anatomy of this topic is that the lumbar puncture for giving various anesthetics, for collection of CSF, for to sending for testing, it is done in the area of L5 to L4, because in that area the subarachnoid space along with the CSF is ample, but there is no risk of injury to the spinal cord in this area, because as we know, the spinal cord ends at the level between L1 and L2. Now, this is the MCQ section for your exam preparation, for your entrance exam, for whatever exams you're planning to give. These are the MCQ points. The spinal cord ends at, again, this is a very controversial question, and you have to be very precise in whenever you are giving the exam, and whichever exam you are giving and what book they follow, that it ends between the L1 lower border or the L2 upper border in adults, obviously in adults. Now, in children, there's not much controversy. It ends at L3 upper border. And what is the age that we consider for children? Less than 2 years, because after that there is a discrepancy, but if it specifically asks less than 2 years, then it the upper border of L3. The pia mater, where this ends at the coccyx, as we have all seen. The dura mater, now there are 2 points in dura mater. Where does the dura mater converges or tapers? The dura mater converges at the level of S2 and ends at the coccyx. Now, the lumbar puncture, it is done between L3 to L4. Hello everyone. So today we'll be studying